heart-wrenching tragedy strikes a beloved animal sanctuary as a deadly virus claims the lives of 24 innocent cats. Imagine the heartbreak of watching furry friends succumb one by one. But here's where it gets controversial. Could this outbreak have been prevented with stricter intake policies or earlier vaccinations? Dive in to discover the full story and see why this incident sparks heated debates in the animal rescue world. In the heart of North Yorkshire, Filey Cat Rescue has been devastated by a highly infectious virus outbreak that has tragically ended the lives of 24 cats under their care. The dedicated owners have shared the harrowing details, explaining how the crisis unfolded and the heroic measures taken to protect the remaining animals. It all began when a cat arrived at the center showing signs of illness, refusing to eat and appearing lethargic. Concerned, the team rushed her to the vet, only to receive a devastating phone call. She had passed away and tested positive for panleukopenia, a severe and highly contagious feline disease. For those new to this, panleukopenia, often called feline distemper, is a viral infection that attacks the immune system and digestive tract, proving especially lethal to young kittens who haven't built up natural defenses yet. It's similar to how measles can ravage unvaccinated children, spreading easily through contact with infected animals, their feces, or contaminated environments. Recognizing the gravity, the rescue swiftly imposed a strict lockdown to curb the virus's spread. With over 300 cats in their care, this was no small feat. Think of it as isolating different wards in a hospital to prevent cross-contamination. Head of Operations Tina Lewis described the past month as absolutely terrifying, a testament to the emotional toll on everyone involved. The outbreak stemmed from a group of 6 cats brought in together, one of whom was the initial victim. Out of around 60 to 70 cats that contracted the virus, 24 didn't survive, many of them fragile kittens as young as 4 weeks old. Their tender age meant they lacked the immunity to fight back, and even attempts to vaccinate some came too late. Additionally, some older cats with weakened immune systems or pre-existing health issues also perished, underscoring how panleukopenia doesn't discriminate, it exploits vulnerabilities in all felines. In a desperate bid to contain the damage, the rescue enlisted 8 volunteers for thorough deep cleaning, focusing on areas affected by feeding routines where the virus might have lingered. They then enacted a critical lockdown. Only 2 staff members cared for the healthy cats, while Tina handled the sick ones solo. This isolation was so stringent that Tina hasn't stepped into her own home for 4 weeks, sleeping on a settee to avoid risking the lives of tiny kittens inside. "It's been really hard," she admitted, painting a vivid picture of the sacrifices made for these animals. Normally, Filey Cat Rescue vaccinates cats just before they're rehomed to manage costs wisely. But faced with this emergency, they had no option but to launch a widespread vaccination drive to shield as many as possible. Run entirely on donations, the financial hit has been brutal. Vaccinating each cat can cost around £100, and with intakes sometimes numbering 20 to 30 from a single source, justifying such expenses without steady funding is tough. Mark Lewis, Tina's husband, highlighted the strain. "It's obviously physically draining, but I think it's more mentally and emotionally draining, especially for Tina because she's worked with them tirelessly every minute, every day, and had to deal with the fatalities that we've sadly experienced. This nonprofit relies solely on unpaid volunteers, with every donation directly benefiting the cats. They've now issued a heartfelt plea for support to rebuild and continue their life-saving work. And this is the part most people miss. In a world where animal rescues operate on shoestring budgets, balancing urgent health needs with fiscal reality can lead to tough choices. Some argue that earlier, universal vaccinations could prevent such tragedies, potentially saving even more lives, but at what cost to donors and the overall mission? What do you think? Should animal rescues prioritize expensive upfront vaccinations to avoid outbreaks, even if it strains their limited resources? Or is the current approach fair, given the reliance on public generosity? Share your thoughts in the comments. Do you agree that stricter intake screenings could change the game, or is there a better way to support these heroes? Don't hold back. Let's discuss how we can help prevent stories like this in the future. Get in touch. Share your ideas on which Yorkshire stories we should cover next. Tune into highlights from North Yorkshire on BBC Sounds, https://www.bbc.co.uk/sound/curation/p0cjf284, and catch up with the latest episode of Look North, https://www.bbc.co.uk/programs/b006mj5m.